My message to dentists, this is not something that non-dental professionals may understand, but as dentists, when you qualify and you're deciding what to pursue in your postgraduate training or what type of dentist you want to become, I think it's absolutely fantastic that you embark on a career in orthodontics or endodontics and so on. But your single best talent as a dentist, and this will never change, is the ability to get someone out of pain. The ability to help someone at a single point in time intervene and make a difference to them there and then. And as you know, there's a lot of young dentists now coming along and they simply want to do composite bonding for a living. They just want to do porcelain veneers. And yes, these are all fantastic treatments and rewarding in their own ways. But please do not become de-skilled to the point that you can't perform an emergency intervention. Because that's what's happening around us. Majority of the people are in pain. Majority of the people have issues. And the more time you spend away from removing a tooth, you won't be able to remove a tooth. Even dentists practicing every day as general dentists, they struggle to take out half the teeth and they're being referred left, right. So if you haven't done it for some months, for some years, you're going to feel like you're back in dental school. And as we all know, if you don't feel confident, you can't do the procedure. Try and keep your hands in a little bit of emergency dentistry. There's no shortage of patients. And I completely sympathize with you why you don't want to work in the NHS emergency service. But let me just tell you, I'm not the world's best dentist. I'm decent, I'm okay, I'm average, whatever you want to call it. But the most dentistry I learned was actually in the NHS 111 service. I used to work down in Southampton on Saturdays in a town called Shirley. And boy, did they have very high needs. You know, I used to open the surgery door and it was like a classroom lined up with 30 chairs and everybody was staring at my face, waiting to be seen. And unfortunately, our appointments were booked every 10, 15 minutes. And even when the practice shut at 8, 9 in the evening, there was still 30 people sat there waiting and they were all turned away. And it was always like that every day, 7 days a week. And I'm pretty sure it's probably still like that. And what I did there was I was able to see a broad range of conditions. I was able to speed up my dentistry, time management I learned. People are in pain. They want the tooth ripping out. Obviously, if you feel comfortable, you get in there, you numb them up, you ask them to take a seat in the waiting room, you get your next patient in, you consult them, and that time management, that the value from doing that service is second to none. And I really recommend it. If you have just recently qualified as a dentist and you want to upskill, I'd say get yourself a job in the 111 service. You will learn tons. You'll have ample opportunity to remove teeth, ample opportunity to provide pulpotomy, ample opportunity to provide temporary fillings, ample opportunity to try and provide some form of cosmetic fixes to anterior teeth when they're chipped. And a lot of the patients are actually really nice. They're not going to hold you to account. They're not paying you thousands of pounds and, you know, hopefully they're not going to hold you to account, but it gives you an opportunity to practice in a safe environment. It's very pressurizing. It's very daunting when you first do it, but the more you do it, the more comfortable you will become. And for dentists as a whole, you know, do whatever you're doing and continue doing what you're doing, reach the stars, but just remember this in the back of your head. Ask yourself this question: if a patient comes to me now and they're in pain, can I make a difference? And if you've realized that you've de-skilled to the point that you can't perform average extractions, or you haven't opened a pulp chamber for some time, the answer is you probably can't do it. And I think everybody should offer half a day to a day a week to get people out of pain, because the people are suffering.